Hi, I'm Dr. John Morrow. Our clinic has been specializing in reversing thyroid for about 12 years now. Most of you came to your doctor with weight gain, hair loss, and you've had the same symptoms as your coworkers or your neighbors or your family members did, and pretty much knew or thought you had a thyroid issue. And some of you actually tested positive for an abnormal TSH levels, and some of you actually had negative test results. So there's a reason why you've had negative test results but you still have symptoms, because you know that you didn't feel like this or you didn't used to feel like this. So there's a reason that the tests are come out negative even though you have symptoms, because mainly you're not sick enough yet. So your thyroid isn't damaged enough for it to actually show a positive. But so the medical doctors are kind of usually in a little state of confusion. Some of them, most often than not, will actually go ahead and prescribe you thyroid medication. I kind of take that for face value, so it is what it is. But in our world, what we do is we find out the cause and we address the causes of your thyroid imbalance and or your abnormal lab values. Just because you have an abnormal TSH level doesn't mean that you have a thyroid issue. There are many factors that are associated with your thyroid that can actually give you a false positive TSH. And I found in the 12 years of doing thyroid work that just about 90% of the patients that are diagnosed with a low thyroid are misdiagnosed. And the reason being because there's other causes and factors involved. If you weren't born with a low TSH and you didn't always feel like this, then there's usually a cause. And in practicing functional medicine, and most of my post-grad work since graduating 1990 has been in functional medicine. So most of the symptoms that you guys are experiencing is fatigue, weight gain despite adhering to a low-calorie diet, morning headaches that wear off as the day progresses, depression, constipation, hypersensitivity to cold weather, poor circulation and numbness in the hands and feet, muscle cramps while at rest, increased susceptibility to colds and other viral or bacterial infections, and difficulty recovering from them, slow wound healing, excessive amount of sleep required to function properly, chronic digestive problems such as a lack of stomach acid. You know that little blue pill that a lot of you guys are on for the rest of your life? Yeah, once again, if you're on a medication for the rest of your life and it's still not solving the problem, then obviously they're treating symptoms, and that's not what I think you really want to be doing. Chronic itchy skin, dry or brittle hair falls out easily, a low body heat temperature, edema, facial swelling, and sometimes in more severe cases, the loss of your outer eyebrows, and of course, decreased libido. So brain fog, you actually can go into a room and kind of forget why you were there, or go in there and forget what you were looking for. You know, your recall isn't quite what it used to be. And you don't have to have all these symptoms, you can have just a few of them. And the longer you're on bioidentical hormones, the kind of worse it gets. Some of you actually had some pretty good results in the beginning using bioidentical hormones. It's kind of like a bell curve. You actually start feeling good in the beginning and it kind of tapers off and you're back down to you were in the beginning, if not worse. So, you know, in doing this in 12 years, I have a lot of frustration that you do, because I see medical doctors every day just looking at one value on your blood work and writing a prescription for you and getting you out of their office and asking you to come back in 6 months, and guess what? They're going to watch your values, and sometimes they may increase your medication, and another 6 months, well, they may lower it, and another 6 months. So they kind of play this game and obviously not addressing the cause. So with functional medicine, we actually know exactly what blood test to order, and we really do our detective work to find out exactly which biochemical factors are breaking down. In our office, during the consultation, we can, in evaluation, we can actually find out there's 5 major pathways that your body becomes disconnected with, and that's pretty easily identifiable. In the workshop, what we usually talk about is those 5 major pathways, and we'll talk about a few of them today, but overall there's 22 biochemical pathways that can give you a false positive for TSH. So if your medical doctor isn't trained, and I hear this all the time, well, why doesn't my medical doctor know about this? Well, he's trained to look at certain values and write a prescription. In functional medicine, which is what we do, we actually can determine the cause, treat the cause with nutraceuticals, pharmacy-grade nutrition, and heal those areas of down-regulated or areas in your body that are just completely not communicating. You know, one of the issues with a misdiagnosis of thyroid is you're taking a thyroid hormone which replaces the job of the thyroid. So in a sense, the thyroid completely shuts down, and over time it will degenerate, and the longer that goes on, you could actually lose your thyroid and have to be on some type of medication for the rest of your life. So again, not a solution to a problem, because again, treating the symptoms. So one of the earlier symptoms we talked about, digestion, right? If your digestion isn't 100% and your bowel movements aren't, 2 to 3 times a day, most of you don't know that there's a huge conversion of T4 to T3 in your digestive tract. So if you have some digestion issues, that's going to be one of the first places we look at. Another area is there's 2 areas of the brain that actually communicate with the thyroid to tell the thyroid what to do in communication with the rest of the body. So it's almost like you trying to tell your husband or your son, your teenage son, right, to take out the trash when they're looking or watching TV. And they totally are not, paying attention to you. They're totally focused on something else. Well, it doesn't mean your son has a hearing disorder. He's just being distracted. And that's what's going on with your thyroid in a general way of speaking. Like I said, there's 22 other biochemical functions that can show up on blood tests if you know how to look for it. And there's nutraceuticals that go along with every one of those. And that's how we're actually able to reverse thyroid without taking medications for the rest of your life. Now, if the medications were working and every one of your symptoms were coming back and the fatigue factor was gone, and let's talk about fatigue factor. Some of you are so adrenal fatigued, and most doctors don't even know this, but there's 7 stages of adrenal dysfunction. So if you've been under a lot of stress, having ups and downs throughout your life, that eventually will take a toll on your body. And the more imbalanced you get, the more imbalanced you get. So there's ways to determine exactly what level of adrenal dysfunction you are, because if you have a high cortisol level, then guess what? That's going to affect your TSH. Some of you are having borderline cholesterol issues. Guess what? That affects TSH. Some of you are having some blood sugar issues. Guess what? Another issue with TSH. So some of you are very, very toxic. Another issue with TSH. So we don't really compartmentalize our patients in our practice. We don't send you to a GI doctor, to a liver doctor, to a pancreatic doctor. We actually know how everything in the body works. Based on the blood work, we know everything is supposed to be communicating. And if it's not communicating, we find it, we correct it, symptoms go away, and you get your life back. So it's a pretty neat program that we've established. I've treated hundreds of patients over the last 12 years very successfully. I know most of you probably signed up for the workshop, but I kind of wanted to give you a little tidbit of information about kind of what the workshop is going to be about. And some of you are maybe not ready for this, but some of you are. And if you're on medication and your symptoms are not going away, then it's a very bold statement, but most of you are misdiagnosed. If the medication was working, guess what? Then you wouldn't be watching this video or searching for something else. So the fact that you are still having fatigue or insomnia or brain fog, hot flashes, depression, and weight gain is telling you that somewhere someone is missing the boat. So I'm not here to point fingers, I'm just here to help. So I look forward to meeting you, to evaluating you, and helping you get your life back on track. Take care.